Well, you've heard it before. Health is wealth, but billions of people in the world go to the doctor and they leave with a health scare. I'm Amir Massenberg. I'm helping you stay on top of a lot of health issues when it comes to preventing and treating them in your hometown health. We'll start with the #1 cause of death in the country, heart disease. Doctors say it's a myth that you have to be old, overweight, or live a sedentary lifestyle to have a heart attack. They actually say a lot of people that do have them look like the perfect picture of health and had no idea they were at risk. I'll tell you how UVA researchers are making sure you stay on top of your heart health with their new testing options. Dr. Todd Valines at UVA says recent data looking at millions of Americans who came into the hospital with their first heart attack shows more than half had no symptoms at all.
And what we've learned is that we're not doing a great job at predicting who's going to have heart attacks, and we're not doing a great job at preventing them.
Only checking the numbers for common risk factors like cholesterol and blood pressure may not be the perfect way to predict who's at risk for a heart attack.
Well, I have patients who come in and say, every person in my family's had a heart attack before the age of 75, but yet their blood pressure looks good, their cholesterol looks good.
He says only 1 in 5 patients who had their first heart attack knew they were at risk and were receiving treatment for it.
We can now, with very low radiation dose CT scans, look and see, do you have early plaque buildup in your heart arteries that we wouldn't otherwise know about?
It's called coronary artery calcium scoring, helping doctors figure out exactly what needs to be treated to prevent a heart attack.
Maybe we should be more aggressive with your blood pressure. Maybe we should be, really treating your cholesterol more aggressively. Or maybe that information helps the patient accept the fact that they need those medicines.
Dr. Valines recommends this testing to men over the age of 45 and women over 50 who have not had a heart attack or stroke, aren't sure about their heart health, or have a family history. He also recommends requesting a lipoprotein a test from your doctor. This does not come with standard testing.
I've got patients who look like the picture of health, who their regular cholesterol panel is normal, but this is very elevated. And that cholesterol is actually the most harmful type of high cholesterol. It
offers coronary artery calcium scoring 7 days a week. While doctors are still trying to get a really good grip on preventing heart disease, they've been battling another disease that's highly contagious, measles. We're seeing more and more cases pop up nationwide and even right here in our hometowns. There's been a push to get vaccinated, but many are questioning if you can still contract measles if you're vaccinated, and if so, is it even worth it to get the vaccine if you're not already protected? Here's your answer. 2 doses of the vaccine that protects against measles are about 97% effective at preventing infection from the virus. But what about that other 3%?
Nothing is 100% effective. They don't make you, immortal.
Dr. Sarah Nozel with the American Academy of Family Physicians says it's rare, but about 3 in every 100 people exposed to measles can still catch the virus even if they're fully vaccinated against the disease. However, she says getting both doses of the vaccine significantly lowers the risk of being infected. And if you do get sick, she says the illness isn't likely to be as severe as it could be in an unvaccinated person.
Sick, at first it can look like a cold. You can get a fever and a cough, red eyes, runny nose. But as you get more sick, 1 in 4 individuals, children who get measles, will end up hospitalized.
Less than 3 months into 2026, there have been 910 confirmed measles cases reported to the CDC. Of those, 94% were in people who were either unvaccinated or their vaccination status was unknown. 30 of those patients were hospitalized, most of them under the age of 5.
Doctors are afraid of measles. Measles is incredibly scary in the sense that it is so contagious. So if you haven't been protected with a vaccine, you are very likely to get infected if anyone around you has the measles.
One that's not contagious and unpreventable. Bunions. They're genetic, painful, and can make shoe shopping very annoying. After a failed surgery and 20 years of excruciating pain, a Roanoke woman finally found relief with a modern bunion surgery offered right here in our hometowns. Here's how it went. If anyone knows anything about severe pain from bunions, it's Monica Nicely. After suffering for years, she had traditional bunion surgery to remove them.
I was on crutches for probably 6 weeks. And at the time, I was a school teacher in a really big school. And so I taught third grade. And so to have to like lead your kids to lunch and do all of those things on crutches was a nightmare.
After getting through that, she thought she was over the hump, bunion free. So she thought. It wasn't long before she noticed the bunions were coming back.
You're angry, right? Because it is painful. And especially the first time to be off your feet for that long.
Back at square one, the dreaded shoe shopping trips and the excruciating pain were back, this time while raising a family.
So I had the surgery before I had kids on purpose. So I decided I would look into getting another surgery, and I did some research and I came up with Dr. Putnam.
Dr. Ryan Putnam, orthopedic surgeon with Carilion Clinic. Also, the first doctor in our region to offer what's called Lapiplasty.
And Lapiplasty is essentially taking the underlying anatomy that's abnormal and trying to restore it in a normal manner.
Its reoccurrence rate is only 2 to 3%, as opposed to 70% with the traditional surgery, and a much easier recovery.
But at their first post-op visit, I put them in a walking boot and let them walk fully in that boot for a period of up to 6 weeks.
This advancement completely transforming Monica's life.
And to not have pain and not to have those restrictions buying shoes and all that kind of stuff, I mean, I got a long life to live.
I've highlighted various diseases that have affected celebrities this month, like cervical cancer. Jersey Shore cast member Snooki opening up about her recent diagnosis, and another one that really broke hearts, actor Eric Dane losing his life to ALS. ALS has been around for decades, and still there's no cure. It's not preventable, and no one is exempt from developing it. Here's what it looks like when it's developing. It became more internationally known in 1941 by the beloved baseball player for which it was named. But ALS, or Lou Gehrig's disease, was first identified in 1869 by a French neurologist, and still today, there's no cure.
Quite honestly, we are yet to completely understand how it comes about, what causes it, what are the drivers.
Dr. John Morin with Cleveland Clinic says a small minority of ALS cases are genetic, but often there's no clear cause, making it hard to prevent or reverse damage and stop disease progression. Red flags include arm weakness, inability to use your hands or legs like you used to, foot slapping or foot dropping, which leads to stumbles and falls and affects gait. It could also begin in your head, neck, or face area with difficulty speaking, controlling saliva, chewing, and swallowing. There could also be breathing issues, shortness of breath when you lie flat, causing you to lean forward to breathe better.
There's not a lot of pain or sensory symptoms like numbness, tingling, burning, prickling. That should be brought to your doctor's attention.
Morin says since symptoms appear in a sporadic fashion, they're easier to dismiss. The CDC says most people with the disease only live from 2 to 5 years after those warning signs develop.
Quite often, the diagnosis takes more than a year or so in the United States. So that diagnostic delay also adds a challenge to this disease.
I've covered a variety of challenges people must overcome every day, and that, of course, wasn't all of them. So be on the lookout for another edition of Hometown Health. Hopefully, it'll help you or a loved one.